Let's turn now to health care. Congress has a few precious weeks to hammer out legislation before its summer recess. So as a result, our next guest foresees a flurry of health care headlines this summer, and he says it's a less than ideal time to invest in those stocks. Joining us now is Thomas Carroll. He's the healthcare analyst at Stifel Nicolaus. Hi, Tom. Now, first off,
good morning. How you doing?
I'm good. Thank you so much for joining us. Why is now not a great time to make a bet on healthcare? Because increased news flow does usually mean more opportunities.
Yeah, great question. I think what we're seeing right now is, especially into the summer, is, as everybody knows, a big pickup in discussion about healthcare reform and what that is going to mean for all facets of healthcare. I personally cover the managed care sector, and we've been relatively positive on it this year, especially off of January lows. But as a number of those stocks have really worked well, for example, WellPoint has gone from 30 to 50 something. I think we've been really recommending that investors look hard at why they own these stocks right now, understand we're going to have a lot of headlines, potentially volatility to the downside. Might be time to trim some of those profits right now before we get more a view of really what the world's going to look like in the coming months, years, and decades even.
Now, I was taking a look at the managed care ratings that you have. You have hold ratings on all but two names. What other groups within healthcare would look more or less attractive as Congress tries to wring out more cost savings?
Again, the answer to that is, it depends, right? It's like being a healthcare analyst right now is like being the weatherman almost, trying to predict what's going to happen in a world where the winds are blowing back and forth every single day. I think it all depends on the details. One of the most contentious parts of healthcare reform has been a public plan option, really some type of competing government health plan that competes perhaps unfairly with private sector to provide more coverage to people either that need it or can't afford it, and that potentially creates crowd out, moving people out of private insurance into public insurance. So in terms of other sectors, hospitals potentially could be positive. One of the problems with hospitals right now is the bad debt load they have. So if we have more people insured, hospitals perhaps are getting paid something for the services they provide as opposed to nothing. And that's potentially a positive sector as well. I think we saw some of the hospital names up yesterday just on the promise of perhaps much more volume, much more coverage that they would see coming their way, and we have the opportunity to have more payers to services than not. Now, the managed care group, I think, could end up being a beneficiary here if we come up with a means that provide, and I think it's going to have to be a uniquely American solution that provides coverage to a lot more people, perhaps though at lower margins to the managed care companies. That's going to be the real balance. It's going to be more revenues perhaps, but lower margins, and are we going to be able to manage through that and continue to grow earnings into the future?
Tom, in your most recent note, you say the private sector has averted the worst case scenario. Question I have for you, though, is are any efforts to reform health care, to cut costs, to eliminate waste necessarily bad for publicly traded companies in this industry?
Yeah, interesting question. And let me go back to your comment about the worst case scenario. I think back in January, investors' fears were we were going to a single payer system where a number of these companies would just be wiped out. That was a great opportunity to own these stocks, and it was really the crux of our thesis on the group this year. But in terms of, the second part of your question is I guess, the need to control healthcare costs necessarily a bad thing? And probably not, because a lot of these organizations out of the private sector that have evolved over many years are really creating solutions to help tie physicians together, bring healthcare HIT together, and provide a lot more flow of information to help facilitate the provision of care. So at the end of the day, some of the big programs that are out there today, like Medicare, like Medicaid, that are really, fee-for-service based programs, need to have more integration, better care for chronic illness.
Great. Tom, healthcare is traditionally considered a defensive sector. Is it still right now? Will it be?
I think, the defensiveness of healthcare across the board has really been in question through the downturn in the markets here in the last couple of years. And I think traditionally that it gets the defensiveness characteristics out of large pharma, which have paid a nice dividend and historically have always been an area where you could go to and kind of weather the storm, so to speak. But, pharma's got its own issues, and then the whole cloud of healthcare reform basically saying, we don't know what's going to happen in the future. And I mean, the whole structure and how the U.S. health system could look is a lot different.
Thanks very much. Tom Carroll live from Stifel Nicolaus's trading floor in Baltimore, Maryland.